Objectives for this module are the following. To help you better understand the terms minority tax or taxation and a new term titled diversity capital, helping you understand how you could turn minority taxation into diversity capital, especially in completing diversity, equity, and inclusion work, which has received a lot of social and political attention lately, and to describe and help you understand how to overcome being overtaxed and use DEI work as another metric of academic success. I really like audience participation. So when you hear the word metric for academic success, what are typical metrics for academic success? Can anyone share? What are typical metrics for academic success?
Publications, number of
Excellent.
publications.
That's right, publications. Anyone else? Or a second thought, what's another metric?
Promotion.
Yeah.
Abstracts.
Abstracts. What else?
Your academic rank.
That's right. If you hold multiple positions or wearing multiple hats. Okay, excellent. Okay, so I'm gonna first start off with a term that makes us all feel uncomfortable: tax. The big T word, tax. Thankfully, we're not in tax season right now, right? But as you know, the word tax or taxes are sort of mandatory contributions that are levied on individuals by a government. And typically taxes are used to help fund essential services. When we think about essential services, we think about defense, highways. What I've thought a lot about is street erosion in Puerto Rico and all the potholes. I've actually had 2 tires blown out in the past 6 months because of potholes. So taxes serve great benefit in many ways. There's also academic medicine tax, right? So whenever you're part of a country, an organization, there's always some taxation. And some would view the academic medicine tax as the contributions that are levied on faculty, staff, or learners by an institution, right, that you're a part of, that you've decided to become a part of, either by applying there to get in, right, as a learner, or applying there to be hired. And these taxes help to meet a common mission, vision, or strategic plan. You can sometimes break the taxes down into one of the mission areas, right? Because most schools not only have the primary mission, but are also responsible for leading educational excellence, clinical care excellence, research excellence. I'm grateful that UCC, where I'm at, has DEI in their mission statement. And unfortunately, at some schools across this country, DEI cannot be a part of the mission anymore. And community engagement, we talk about it, but sometimes it's actually not listed in the mission of the institution. I personally feel it should. But I only mention this because there's variation between missions across schools of medicine or even public health schools. And it's not only about having mission areas, but also equity in achieving the mission areas. And we know that historically, schools have done a great job of defining metrics for people to be promoted through their educational work, their clinical work, their research work, right? You want to get promoted as a research faculty member, how many grants do you have or publications? In clinical care, how many patients are you seeing per hour? How many procedures or how much revenue you bring in? Education, how many students are passing step 1 on first time or step 2 on the first attempt? DEI, I still think we're determining what those metrics are, and in community engagement as well. But equity in achieving mission areas, what are the metrics, what are the outcomes, are really critical to understand and know. So when we say minority taxation or the minority tax, what does that mean to people on the call? Before I go to the next slide, how would you describe or define the minority tax?
So this is Miranda. I would describe it as
twofold. One, having to work twice as hard as non-minoritized folks, and then also being kind of burdened with thankless, unpaid labor related to DEIJ efforts on like by your institution.
Excellent. You nailed it. You nailed it. So, when you look in the literature, there's a lot of definitions and descriptions of what minority tax or minority taxation means. I think Miranda, you summarized what appears in the literature. It's an additional mandatory contribution levied on minoritized faculty. And when we think about minoritized, some individuals are minoritized by race, ethnicity, gender, sexual orientation, language. It could be in many different dimensions. And it could affect faculty, staff, or learners who based on who they are, they have to give more to help the institution meet a common mission or strategic plan. And central to the concept of minority taxation is the problem that there's a lack of equitable return for minoritized individuals as they help the institution meet their stated mission and vision and goals. One definition that was put out by Campbell and Rodriguez is minority tax is the burden of time and resources placed on minoritized persons to represent and advocate for their communities. In addition to what Miranda shared and what I just shared, does anyone want to make any other mention about minority taxation or provide any other thoughts? Okay.
I guess I would add one thing.
Sure.
I would say that there's an unspoken deficit in the work that you can do that's outside of the DEA space because your time gets consumed by the DEI work that is not often recognized.
Excellent. Thank you for that. Right. So it is also how you are faced with taxation in a unique way. If I'm understanding you correctly, you are overburdened more than others to do DEI while also having to meet other things. Did I capture it correctly or?
Yes, exactly.
Sorry. A concept that we want to introduce to the group is this notion of how do you build diversity capital, or what does diversity capital mean? And it's really giving credence and value to the lived experiences of individuals that are either self-defined as being minoritized or considered minoritized, because it's lived experiences you don't get in a textbook, right? People don't teach it. It's the experiences that have allowed you to acquire unique knowledge and skills and community understanding based on your day-to-day activities as whoever you identify. For me, I identify as someone of Puerto Rican ancestry, Hispanic identity, gay identity, and living those identities gives me certain unique knowledge and skills. Often along the way, we also develop competency relative to those identities or communities. There are assets associated with who we socialize and network with, and I'll talk a little bit more about that. It could also garner money or financial resources or other forms of assets. For the purposes of this presentation, we are defining diversity capital as wealth owned by a minoritized person or academic organization. And an example of an academic organization might be an HBCU or Hispanic serving institution, and contributed for the purpose of advancing a mission, strategic plan, or well-being of minoritized communities. So reflections and thoughts on this term and how it's described. Would anyone like to add to this or comment on this notion of diversity capital?
This is Felicia. I appreciate this in that it's sort of the continuation of what we think about when we're looking at holistic admissions, right? Like we're thinking about looking at the whole individual, their lived experience, the diverse backgrounds that they come from, and why that's going to make them an asset to be in the medical school class, a residency school class, or a residency class. And so similar that in faculty, like those things that you carry with you should be valued. And those additional experiences you get doing the work is added value to your role on the faculty. So I like that continuity of that concept.
And I also like the idea that we all benefit from diversity. So, like making very clear that the wealth that comes from the strength, the asset that comes from an academic institution making those commitments to building and maintaining diversity, I think is a really important, necessary, emphasis.
Great. Thank you, Felicia, to commenting on holistic admissions and not viewing individuals as deficits, right? But actually as strengths, and Miranda also for commenting on, what we mean to our institutions.
There's a couple of comments in the chat, Dr. Sanchez.
Please share, Caitlin.
Yeah. So one says also being told that this is a good opportunity for your professional development when it's not expected of non-minoritized individuals to promote their own professional development in those regards.
Great.
This comment says, thanks for introducing us to this concept of minority tax. It's something that many of us have experienced but never knew there was an official term for it. And then a question. Does this apply to the federal grants received by academic institutions for having a certain percentage of Hispanic students, for example?
So that could be minority taxation, or it could be diversity capital, right? And so that's also a great question. Sometimes institutions are given certain federal funds because they have a certain proportion of learners of Hispanic identity. But it's not only about having a certain proportion, it's also thinking about, are they actually graduating them? Are they achieving student success for individuals who identify as Hispanic or African American? And if not, then that's more of a taxation. If yes, if they truly are achieving better outcomes, then that could be generating diversity capital. So I just want to share some additional quotes on minority taxation by articles in the literature. The first one is by Dr. Rodriguez. Sometimes I felt like I was paying a gratitude tax, which kept me from seeking new positions. I had traveled so far economically and professionally that I was overwhelmed with gratitude. Early in my career, I lost precious time for career progress because there was not structure in place to assign value to the service I was providing to URM patients. So sometimes we're so grateful that we were given a first job to serve our community that we give more of ourselves and lose track of the metrics that allow us to continue having success as a faculty member. Dr. Campbell says, my first job landed me on several committees and required lots of community engagement, leaving little time for scholarship. At the time, I was unaware of the importance of scholarship in career advancement. For me, that translated to finding myself on the sofa at night and on weekends writing, and sometimes using my own resources, independent of those provided by the school, to advance my career. This comes from students in a separate publication. They wrote, I think this was a perspective piece. In light of recent calls to action for racial equity for students of color, this task is a welcomed opportunity to inspire meaningful change and conversation to improve the lives of marginalized communities. These students' increased involvement with activism may limit time for academic coursework or professional development and could directly impact resident selection and placement. Just another example of how faculty and students talk about this notion of minority taxation and have published it in articles. So here I'll just share my own personal perspective to provide a different dimension Dr. Rodriguez and Dr. Campbell and the students in their articles talk a lot about race, ethnicity. I provide this, in the literature, there's some publications on the death tax or gender tax or women's tax. Tax can come in many forms. I'll share, what I consider to be the LGBTQ plus tax, and that personally, within academia early on in my career, I often felt like I had to be straight or straight identified for opportunity and for convenience until people needed me to be a co-PI on a grant. And then for the institution and for the grant team, it was advantageous for me to be out and gay. And often I would be called to have me join an HIV grant because HIV grants were viewed as needing someone who was out gay individual. And so as long as they had my name and as long as they could say, they had me say I was gay in my bio, that helped them get the grant. But rarely was I given other opportunities like funds through the grant or an opportunity to co-author a publication on the grant. And so sometimes you do it to serve the institution, but you miss out in opportunities that are afforded to other individuals. And publications that I did on the LGBT community, early on in my career, my chair didn't put any value to it, even though I was getting publications. But the notion of valuing a faculty member that was doing LGBTQ related work was, the chair didn't feel like that aligned with the mission of the institution. The culture has changed. And hopefully today, the experiences that I had in the late 90s is different because of federal changes in worker protections, such as the 2021 ruling of sexual orientation and gender identity as a part of the Civil Rights Act of 1964. So I just want to pull up very quickly an opportunity to learn more about your own experiences with minority taxation. I'm going to start our next. So break out your phones. Break out your phones. I want everyone to participate. And for this next Slido activity, what I want you to do is, oops. Sorry. Okay. Can you see the Slido QR code? Yes. All right. So please take a moment and use this QR code. Oops. Let us do the poll. So the first question is, have you experienced minority tax or taxation in the past 12 months? Have you experienced minority tax or taxation in the past 12 months? Have you experienced minority tax or taxation in the past 12 months? You can use your camera on your phone to use the QR code, or just go to slido.com, type in this number, and it'll connect you to this quiz. Have you experienced, so far we have 17 respondents, and in the past year, 59% have experienced 61% of the 18, 63% of the 19. So we'll give it 10 seconds. So the majority on this call today have experienced minority taxation. Of the 20 respondents, 65% said yes, 30% no, and 5% unsure. Okay. Okay. Now, here's an opportunity to write in if you feel comfortable. Remember, this is anonymous. I don't know who's writing in these responses. This anonymous poll. Please take a moment and now share an example of minority taxation that you have experienced or you have witnessed at your institution. So something that you yourself have experienced, or maybe you've witnessed someone else have to deal with. Once again, do not put your name, no identifying information. Okay. So some of the things mentioned, as you can see here, disproportionate burden of faculty of color doing the DEI work, increased committee service, being asked to lecture on various DEI topics. Disproportionate amount of DEI topics versus others, explaining barriers in obtaining culturally and linguistically competent care for Latina populations and how they may differ. Being taxed disproportionately to advocate for the LGBT community, disproportionate burden of search committees because there is a school policy that requires that there be a faculty member, minority faculty member, whether by race, ethnicity, or gender at times. In a Puerto Rican institution, mainland American or ironically the minority, I've seen the struggle some go through to language barriers and lacking cultural competency towards the North American culture. So thank you everyone for sharing, all of these examples. This is what you and your colleagues are living with and dealing with every day. And it doesn't feel good, right? And it could be overwhelmingly an affect, our well-being, physically, mentally, emotionally, not only our well-being, but our families' well-being, because we come home to partners, to children, to pets, right? And what we're experiencing, we pass secondhand to others, and that affects their well-being as well. So let's just in summarizing much of what you've already shared. When we talk about the minority tax, it comes in very different versions and flavors. We might have a disparate burden of supporting diversity efforts, managing a greater level of racism or ethno-racism, isolation, disparities by mentorship, a greater amount of clinical obligations to serve URM communities, or dealing with the promotion disparity. And we'll look at each of these. So when we talk about diversity efforts disparity, many of you captured it very well. It is having to assume the responsibility to serve in a community that we identify with, or maybe not a community that we directly identify with, but that we've been asked to also serve because people view that we have a unique affinity to that group. So if we identify as a racial or ethnic minoritized individual, let's say myself as Hispanic, I might be called to serve all racial, ethnic minoritized individuals of Black, African American, Native American, or Asian, collectively groups that are minoritized. And you might serve to represent that group as the only person on a search committee, like was mentioned before. Often, many of us face a mentorship disparity in that we are sometimes asked to mentor everyone else of the community because you're the lone LGBT person, you're asked to mentor all of the LGBT students and faculty, or if you're the lone African American, Black woman faculty member, you're asked to mentor all of the other women who identify as Black, African American. So you carry the burden of mentoring everyone else of that identity, right? So that the institution can say, yes, we are serving that community well. The racism disparity, right? That you were asked to be the sole voice to manage racism in the culture or climate, or sexism or homophobia, right? Any ism, you are asked to tackle it, sometimes unilaterally or independently, but to take it on for the entire community. And that can be a completely overwhelming task if you're being asked to do that for an entire school, public health school, nursing school, medical school, an entire health sciences center, or an entire university, especially if you're not given positioning power or resources to do it effectively. In terms of clinical disparity, this was also mentioned by several of you, that sometimes you're asked to take care of a certain group, taking care of all the Spanish-speaking patients because the other faculty only speak one language, or don't feel comfortable, or actually don't do a good job and don't use a language line. Or you may be asked to take on any patient who's a part of the LGBT community, especially individuals of gender nonconforming or transgender identity, because other faculty or residents feel uncomfortable, and so forth. So those are just two examples of disparity by clinical work. Isolation disparity comes in many different flavors. Some examples of isolation disparity, in part, is being that sole member on a committee that's being a voice for a particular minoritized group. Your work, although you might be getting grants or writing publications on, let's say, Native American health, it's never discussed or never celebrated by the chair or by the dean of faculty affairs, or you're not promoted, right? You might have 20 publications on Native American health and are getting grants, and no one talks to you about moving from associate or full professor, or being the vice dean of faculty affairs in your department, although you are completing scholarship on par with others. The promotion disparity is evident in multiple publications. Nunez, Smith, and Fang have shown that individuals of Black, African American identity, Latino identity have slower promotion from assistant to associate professor and from associate to full. Sheer knowledge of these statistics serves as a barrier in itself, but underlying this are systemic issues. And why is it that individuals of Black and Latino identity, despite being hired, despite contributing to mission and vision, are not being afforded the same opportunities to be successfully promoted from assistant to associate and associate to full? So just bringing us back full circle, although we've been talking about minority taxation and the disparities that what we saw in the poll, 65% of you have experienced in the past year, there is an opportunity to move from minority taxation to building more diversity capital. For you as an individual doing it on your own, but also organizations aiming to achieve diversity capital. When Campbell and Rodriguez spoke about isolation, one tip to address the tax of isolation is to align your career direction more explicitly with the institutional mission. So when you speak with your chair or with the dean of faculty affairs, commenting that the institutional mission is this and how your work is helping the institution meet the mission and hence why you should be promoted. In terms of the gratitude tax, don't be afraid, and this was discussed in the article by Rodriguez and Campbell. Don't be afraid to seek opportunities elsewhere if you are not feeling well respected or being afforded the same opportunities as others at the institution you're at. Now, it might be difficult because you're moving your family, or you might be leaving your community, but you might be able to return at a later date. And this actually, in the long run, might afford greater wealth for your family and community. In terms of mentorship, it's always good to not limit yourself to one mentor, but have a basket of mentors in a lot of different areas to overcome that mentoring disparity for yourself, but also to identify other people to help you in identifying like-minded individuals within your institution. And then in terms of the diversity efforts tax, it's important to know the literature and some of the emerging better and best practices to help you get promoted in a timely fashion. For individuals who identify as men and as white, on average, it takes 5 to 7 years for them to move from assistant to associate. Yet the literature shows that it takes women, individuals of Black and Hispanic identity and Native American identity twice as long to move from assistant to associate. And that's really concerning because at most institutions, when you get promoted, you automatically get a higher salary. So by not working or advocating for yourself, you're basically letting the institution stay with your money. Before we enter into the case discussion, I want you to think about how value-based alignment can really improve your chances of achieving diversity capital. So value-based alignment is a framework that I want you to consider. As you're engaged in academic work, think about how it's personally fulfilling. Think about how it meets your professional interests. Be able to convey to your chair and the promotion committee how these activities that you're engaged with align with the institutional mission, vision, strategic plan of your institution and your department, but also be able to explain how what you're doing improves outcomes for the networks or the communities that your institution or your school are trying to serve. Every medical school, every public health school is located within a certain physical community or says they want to address the needs of a certain community. It's important for you to be able to convey verbally and in writing how what you're doing is helping them meet their obligations to the physical community that they sit within or the community that they say they want to serve. So I want you to think about value-based alignment as we think about cases. Many of you mentioned that you're engaged in DEI work and know that DEI work permeates every mission area. In terms of education, you could be designing, implementing, and publishing DEI teaching and learner assessment materials. In terms of clinical work, you might be engaged in providing quality bilingual clinical care to patients. In terms of research, you might be involved in helping more minoritized individuals become a part of research studies, NIH-sponsored or HRSA, or determining what questions are asked on surveys, right, or questionnaires that are part of research projects. For community engagement, you might be working with pathway programs to increase the number of diverse individuals matriculating or modifying the admissions process, such as holistic review. And of course, in our DEI efforts, you might be leading a climate survey or coming up with a diversity action plan. Lastly, I just want to share some tax reform strategies, which is different, but is related to diversity capital. And this is more on the institutional level. Yes, to really ensure diversity capital, we need the system to change and the institution to change. And we could talk about some tax reform strategies. But to build diversity capital, you yourself can build diversity capital by doing some things differently. On the institutional level, you could think about tax reduction. So when it comes to administrative activities, tax reduction is about decreasing minoritized individuals' participation on committees. Tax deferral is another concept that is mentioned by Williamson in her article, where you don't place minoritized individuals on committees until they're associate or full professor. That way, they don't become distracted from doing the core metrics that'll get them promoted quicker, like a publication or grant. In terms of handling minority and gender affairs, you can introduce a standard tax, which means that minoritized individuals are not the only individuals that are championing minority and gender affairs, but everyone is required to do it. The concept of tax deduction is about measuring when minoritized individuals are involved in committee work, measuring it and giving it the same weight of maybe meeting 2 publications per year or achieving 2 publications per year. And a tax refund is actually paying people extra money if they develop, or giving them bonuses if they develop a new innovative project to support the well-being of minoritized individuals. So these are a variety, and these are examples of tax reform strategies. So now we're going to go into 3 quick cases. We're going to try, actually, we'll just do 2 cases. And what I want you to think about is how to apply value-based alignment or DEI work or these tax reform strategies to address, to help each of the faculty in these cases. So if I could get a volunteer to read case 1 and maybe answer the first 2 questions, and then I'll ask for volunteers for the other ones. Can I get a volunteer to read case 1?
I can read it.
Great.
You are on a 7-member faculty recruitment committee responsible for hiring the next vice chair of education for an internal medicine department. Based on your knowledge of the other members, you are the only self-identified LGBTQ+ member. On one of the applications, an applicant mentions they identify as transgender individual, and they've been engaged in LGBTQ+ related outreach activities. After this application package is reviewed, a senior faculty member states out loud, "I wonder if they have had gender affirming surgery." As the only self-identified LGBTQ+ committee member, you feel compelled to address the inappropriateness of this inquiry. What type of minority taxation is being experienced? How might this faculty member achieve diversity capital through this experience? How is this personally meaningful? How can this be professionally meaningful? How can it align with institutional mission, vision, objectives? How can it align with community-specific needs or disparities? How can this type of minority taxation be prevented in the future?
Great, thank you. So would you like to start us off with a response to any of these questions?
I feel that comment, "I wonder if they have had gender affirming surgery," is obviously inappropriate, but it's said in a committee meeting that has more than just one person. And I think what I read into it and kind of triggered what my own feelings are is sometimes this experience of being like, I have to be the one to say something. And this person who does identify with LGBTQ+ community feels like they're going to need to be the one to do the job that takes a lot of courage and puts a spotlight on a view of addressing how inappropriate that was.
Great. So for some, they might frame it as the disparity, right? Diversity disparity tax as one of the examples. Great. So this is actually a real case that was experienced by one of the co-authors of this module. And I would say this probably still happens in many institutions. What about the second set of questions, 2A through D? Does anyone have, would you like to respond to this, or would anyone else like to respond? So any thoughts on how this could be personally meaningful for the person, how it could be professionally meaningful, how it could align with institutional mission, or how it can align with community-specific needs or disparities? Any thoughts?
So I'll just hopefully get some conversation started, because I don't think I can answer all of this, but I think that it's likely, just from the way that this sounds, that this institution probably doesn't have a lot of LGBTQ representation. And so the fact that this one faculty member who is LGBTQ is on this committee is probably really important for adding that diversity to the committee. The viewpoint that this one committee member can probably bring to the discussion is probably necessary, especially knowing that the committee as a whole is probably comprised of at least one individual who doesn't have much knowledge about interacting with the LGBTQ community, doesn't have much knowledge about what might entail discrimination against the LGBTQ community, because knowing that this discussion is happening on a faculty search committee implies that there could be potential discrimination against this transgender individual. So I think that having this one faculty member who is LGBTQ, who is able to provide some of this knowledge and insight, is really important for the committee itself to be able to do an effective job at recruiting more diverse, talented faculty. And then also by allowing this transgender person who is applying here to have a better chance of being accepted into this faculty community will also increase the diversity capital. Hopefully other people have ideas as well.
That was a great response. Thank you. Excellent. And how could this type of minority taxation be prevented in the future?
I think that there's probably a need for some like really basic workshops about like language and what's appropriate, and talking about gender identity, and maybe even some like Title VII and Title IX education for discrimination might be useful.
I agree with Jonathan. It's like one of the points that can be made in training is really teasing out the difference between intent and impact. And I feel like oftentimes, things get shrugged off or explained away or defended because, well, it wasn't my intention to be offensive or whatever. But it's like, okay, but what is the impact of the statement, the question, the inquiry? And so I feel like minoritized individuals have a tendency to jump in and say something because even though we all, I'll say that there has been a trend in encouraging people to self-educate, right? Stop putting the onus on on minoritized, individuals to be the one to always take up the torch of education and educate the masses. And, you know, that being said, in the moment, it's kind of like a missed opportunity. If you don't say anything, you know, nothing's going to be said. So it's like, you know what, let me say something. And then hopefully that will be the encouragement that's necessary for ongoing self-education. So I think that that's how it's both personally and professionally meaningful to the person who stood up and said something, but also to those on the committee who also sat back, said nothing, and recognizing the importance of not, you know, not bystanding, but then also recognizing like, oh, you know what, maybe I need to do more self-education because I didn't even think that was an issue, you know? So it's like that kind of thing I think is really important.
Excellent. Thank you, Jonathan. Thank you, Miranda. So
There's
let's
a
look at,
comment in the chat, Dr. Sanchez.
yeah, please read it.
How to prevent minority taxation in the future. Aside from better education of staff, it would be important to emphasize the importance of sticking to questions that are pertinent. Questions that you may be interested in the answer to are not necessarily critical questions to ask in a search committee environment.
Absolutely. So having a formalized set of questions that all committee members have to reflect on, and then using that as a scoring rubric, maybe having an equity advisor. This faculty member may serve as the equity advisor, which gives them a certain title, a certain positioning, a certain power with potentially protected time and additional resources to ensure more equitable consideration of all candidates that are in compliance with the new inclusion of sexual orientation and gender identity in the Civil Rights Act of 1964. We'll just do one more case. Can someone read this case and start us off with a thought on it?
I can read this one.
Thank you.
A junior faculty member who identifies as African American receives an email to pose for a photograph to appear in publicity flyers for their division. When the faculty member replies to the email, they notice the only other recipients of the email are the two other members of the division that come from underrepresented racial ethnic communities. There was no information as to why they were the only ones being invited for the photo shoot, or that it was not a division-wide email. In calling and speaking with the photographer, it was mentioned that the institution wants to highlight that they recruit and attract diverse-looking faculty. What types of minority taxation are being experienced? I think we see this all the time when even businesses, departments, medical schools want to highlight their diversity. Yes, and Dr. Ward already said in the chat that this is a kind of tokenism. And it's also like a very public display, right? So it's not just kind of sitting in on a committee behind closed doors, like you might be on a billboard, or you might be your photo might be mailed out to thousands of people. And so it really is kind of a big ask for someone to do something like this. And it was obviously focusing on the 3 racial ethnic minorities in the division, and who knows, that might be a division of 400 people. And so to try to highlight that they're attracting diverse faculty when in fact they're a small number of the faculty could be really misleading and false.
Great. Excellent. And how could this be prevented in the future? Do you want to share that, Felicia, or someone else?
I mean, I think it's even implied already in the write-up that it could have been sent out to the whole faculty group, or there could have been an explanation. We'd like, this is it's going to be going out to people in this particular community. We want to ensure, you know, like there could be some sort of explanation or additional background given as to why this group. But I think that if I were in charge of creating whatever was going to be distributed, I would probably email out to the whole division and make decisions from there.
Great. Thank you. Lori?
So this might get to be a little complicated, but one strategy I would consider is whether or not there's a DEI office or a DEI committee. I would take the request for the photo to them and ask them to create a project where they secure the data that shows the admission of students, faculty, staff of color, and they publish those results somewhere where they can be seen so that you have this comparison and this contrast between the use of the photos and the actual recruitment, retention, and promotion of staff, students, and faculty of color.
Great. Yeah, I think the discussion is bigger than just using their photo, like you're saying, Laurie, that, what are the outcomes of using my photo? And are we going to track it and see if, what else do we need to do? Right. Melanie?
Sorry for not unmuting. This is the exact example that I wrote up in one of the questions that you had previously. And so I've thought a lot about it historically. This was many years ago, not under the leadership of Dr. Rohan Minhades as chair, of course, because she would never do this. But yeah, I mean, years ago with our former chair, they asked for diverse faculty to basically fill out this templated form about your diverse background and kind of how the department has supported your diversity efforts and you as a diverse person. And so for me, it just felt like very impersonal, and this extra work that I was expected to do as a diverse faculty to then put my photo up and a quote that was, found to be favorable, I guess, for the website. And I don't know, I just kind of thought I would like to be valued in a different way for my diverse background and what I bring to the department and our learners. And so I just thought, if you made this something personal, like if this person had said, I really value you for X, Y, and Z and your diversity, and you bring so much, so kind of like valuing me as a person and as a diverse physician, an educator, and making it a personal email, and maybe even saying like, can you find some time for us to meet for coffee or to meet for lunch? And I want to ask you some questions and get to know some of the things that you've, brought to our department and our institution that I'm not aware of. And with your permission, I would then like to highlight you. So I just think your approach or your phrasing goes a long way, even if the outcome is going to be the same, to make people feel valued and not just feel like I'm going to log onto my computer at night and fill out this form and do extra work and kind of feel like a token.
Excellent. Excellent. I think all three. So these are complex cases that happen every day. And sometimes people feel included, but a lot of times people feel excluded or minoritized, and it's a taxation. Really thinking about how you could build capital, which all three of you provided examples of how it could be done better. So Caitlin is going to put the post survey in the chat box because we want to get feedback on this workshop on whether you have a greater appreciation of minority taxation, diversity capital, what you liked about the workshop, and what can be improved upon. I'll just mention this last case. We won't have time to read it, to discuss it as a group, but this happens to our medical students as well. And when our medical students participate in national organizations, a Latina medical student holds the position of vice president of LMSA, an organization with over 3,000 active members. Her medical school has highlighted her appointment in several newsletters, Melanie, and on several pre-health professions panels as a role model. As she prepares to apply for a surgery residency, she meets with her advisor to prepare her ERAS application. When she inquires how to best feature her contributions, her advisor states, "This is not the kind of work that a surgery residency program will value. Talk more about mainstream leadership position work done for all students." So this comes up for our students, for our faculty, for staff. And so this is another type of taxing students and not thinking about how this could be really diversity capital for the student who values this experience, probably on a personal level as a Latina, serving her community. She's vice president. she's taking on a huge responsibility. She's developed management and leadership competencies for her professional development that can be applied as a surgery resident. Diversifying her institution, her medical school class or residency meets the institutional mission and vision. And some of our schools, and I'm sorry to use New Mexico, is 50% Latino in the state of New Mexico, right? So her work is helping the University of New Mexico meet the needs of the community. And there's opportunities like tax deferral, or tax refund. That could be an institutional strategy. So in summary, just reviewing the cases again, case one was really looking more at diversity efforts disparity, helping this person have greater congruence with their community. They can, on a professional level, advance policies and processes to ensure an equitable, fair experience. And on the system level, they could advance faculty hiring, policies and processes related to sexual orientation and gender identity. For case two, it's also sort of a diversity efforts disparity, but also touches upon racism. It could be viewed as community give back. The professional could be hired as a consultant, right? I mean, if they're paying a photographer, if they're paying a media company to often do these advertisements, why can't you give a bonus to the faculty member or student? And on the system level, how can this be recognized as a promotion metric? And for case three, isolation disparity of invisibility, that despite she was vice president, because it was vice president of a minoritized group, it didn't count, right? Her contributions were invisible. She was isolated. But for her, it may have been one of self-affirmation, one of give back. And in terms of a systems level, it's really about how to better train advisors to recognize the unique contributions of students when they apply for residency, or residents or fellows when they apply for their first faculty position, right? So the responsibility of a system to properly train advisors to recognize the contributions that their learners and faculty are making. With that, I know I've gone over, but just quickly want to mention in summary, minority individuals can combat minority taxation by reframing and aiming for diversity capital that they themselves can champion, or champion on the institutional level. Minoritized individuals have unique assets to build academic wealth, and institutions can also create policies and processes that advance wealth. And more and more, the literature is showing best practices and resources to facilitate individuals in advancing diversity capital, but we have to change our mindset and make that a priority, right, of building our own wealth. With that, I want to thank everyone.